Autopsy doctors at Reddit. What was the biggest revelation you had to a person's death after you carried out the procedure? I took forensic lectures, so I saw quite a bit of crazy it. But the things that stick is an autopsy revealing a history of abuse, pain and violence. A little more funny, a skeleton was found in the near mountains. It was very clear he died in an accident 20 plus years ago. However, he had to be identified via DNA. Turned out his dad was not his dad, but his uncle. Sparked a whole public family drama show. Cause the family was well known in my area. My friend had to do an autopsy on a baby. The dad claimed she died after rolling off a couch. My friend found that the kid was slammed against a hard surface multiple times. Dad eventually admitted he hit the baby against the wall after she wouldn't stop crying. My friend had to quit that job cause it was so taxing mentally. When my parents were in medical school, they attended an autopsy of a patient who had died in a car accident. Autopsy revealed that apparently this guy had survived a chest shot in Vietnam years ago that the surgeon's medics left in rather than perform risky surgery. The accident had migrated the bullet to his heart and was ruled the cause of death. My friend once cremated a lady, and when they pulled the table out there were 3 sets of forceps sitting there. Most likely she died in surgery, but I always thought it was crazy those were left in, and whatever metal they're made of clearly has a higher melting point than cremation temps. I'm a veterinarian and sometimes I do necropsy, basically autopsy for animals, and one of the more notable case involved a prized Wagyu cow that died mysteriously. Wagyu cows are very expensive to rear and fetch a good price at the slaughterhouse. After cutting her open, I found metal wires extending from her stomach into her heart. It's what we call a Sahadwa disease. Apparently the cow decided that eating metal wires for constructing fences was a good idea. Normally the farmhands are quite good at keeping these hazards away from the inquisitive bovines, but I guess slip-up do happen from time to time. Not mine, but a doctor I used to work with. Back when he was in school, he would do his cadaver labs really late at night. To many people during the day. One time it was really late, around 2 AM. He was listening to his lecture on his headphones and he saw the cadaver's arm move twitch. He thought it was just his mind playing tricks on him. Then he saw it again, proceeded to run away in a panic. He told a few of his classmates what happened, but nobody believed him. Next day they had a group cadaver lab with the same cadaver. The arm twitched yet again. The professor did some digging and it turns out the patient's pacemaker was still fully functional and occasionally fired, causing the arm twitch. He was so relieved. He thought there was a zombie in there. Masters in forensic pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his 70s apparently came into the ER and had chest pain, then died shortly after. Dies of a heart attack but also had cancer. In less natural circumstances though. Saw a guy who had been shot in the head a couple of times. 3 definite entries and a blown out skull, but police only found 1 bullet. Couldn't find the other bullet in his head at all. Assumed the police missed it. Went on as normal with the autopsy until we got to the chest cavity. The other bullet was just chilling beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck and into the chest. That was pretty wild. This story circulates every year at my medical school. A body came in with a gunshot wound to the chest. There was no exit wound. They tried to locate the bullet during the autopsy. No success. They then did a whole scan, X-ray or CT, of the upper chest, abdomen, pelvis. No bullet at that point. Someone said, "Duck it, let's scan the whole body." Lo and behold, the bullet was detected in the popliteal fossa, area behind the knee. It had embolized, traveled from the heart all the way down the arterial system to the knee, where it got stuck in one of the narrower blood vessels. Sheep farmer. I have to know how to do a necropsy for when something dies to know if it's something that could spread. How do you fall over dead after losing a ton of weight and after treating her for everything under the sun? She would gasp for air and struggle to breathe, but antibiotics, steroids and anti-inflammatory drugs didn't touch it. She finally passed away and I cut her open to see what the hell happened, fully expecting to see her lungs riddled with it. Her heart was 5 times the normal size and hard as a river stone. My guess is she'd had that issue her whole life and it didn't kill her until she was 2. My dad used to perform autopsies. His best story was that they were brought a body that has no real indication of any issues. After examining the body, the only thing of note was that there was blood coming out of the guy's rectum. They begin the autopsy and the guy's organs are completely liquefied and the body cavity is filled with lead shot. It became apparent really quickly that someone had shoved a shotgun up his ass and pulled the trigger. This was in the 70s and I still have to wonder what this guy did to piss someone off enough to get a shotgun up his ass. Training in the medical examiner's office. Elderly woman found dead by herself in her home. There was nothing suspicious, so I was given the case. Took out all the organs. Dissected everything. Completely unremarkable. I cut through the larynx as the last step before I could clean up and finish the case and boom. Giant piece of chicken lodged in her windpipe. Died choking on dinner. I did the autopsy of both a robber and his victim. The robber shot the victim in the back when he tried to escape in a motorcycle, and the robber was shot by the police in the exact same situation. What's interesting is that they both died by exactly the same lesion. Both of them had their 4th lumbar vertebra shattered and their aorta, main artery of the body, sectioned at the same level. I thought of it like an extreme example of instant karma. I heard a story once about a guy who died. And completely unrelated to the main complaint, during the autopsy they found a grapefruit in his ass. Apparently it had just been there the whole time. My wife is a pathologist assistant and during her schooling carried out the autopsy of a newborn that died minutes after birth. The mother was desperate for a child and had a history of multiple miscarriages at different terms. This was her first time making it full term and all prenatal checkups revealed no problems. The delivery was difficult, but successful, and baby was alive for a short time. Skip to autopsy. All signs point to baby being fully developed. Get to the abdominal cavity and the liver is lacerated and hemorrhage everywhere. During the difficult delivery the resident used too much force with the forceps to pull the baby out. A ruptured liver that caused the baby to bleed out internally. Wife was enthusiastic about autopsy up to this point. Now has no interest. My high school science teacher was a coroner or whatever, and one day was asked to perform an autopsy on a little girl who was shot by a shotgun. He quit on the spot. He was an absolutely fantastic teacher. Forensic pathologist here. 2 come to mind. I had just moved back to my home state where family lives. Get a case with a man with a distinctive last name in the family tree. I put a text out to my mom to see if we were related. But before she texted back I pulled the sheet back and already knew. He looked like me. It was my great uncle. Get a case where it's a house fire death. On exam he's got multiple textbook stab and incised wounds. I spend the next 30 minutes getting gaslighted, quizzed by PD about "are you sure?" because they thought this was a straightforward house fire. Unfun fact, fire's not an uncommon way for people to try to conceal homicide. Worked at an animal hospital. They did necropsies for zoos all the time. An alligator died, and they shipped it to the hospital, refrigerated etc to stop the decay. They took it out and put it up on the table. After doing all the paperwork, they started opening up the alligator. After the first cut, the alligator opened its eyes. Turns out it wasn't dead. The zoo vet mistook an illness for death and the low temperature put it basically into a coma. Edit. Unfortunately this is all the information I know on this story. It's been 7 years since I worked at that place. Not a doctor, but a whole body scientific donation technician. I'm the person who dissects cadavers after they were donated. We very commonly would get young cases, normally overdoses. Had a mid-30s female. Went to medical examiner prior to donation, but they only did an external evaluation. I went to check her genitals to see if I could palpate a uterus. Found a condom full of pills. Similar to most. The body became a crime scene and we couldn't touch her. When we finally were able to continue. They asked us to photograph the pills to send to the examiner's office. They were mostly Advil and Zytec. Easily one of the weirdest things I've ever found. I worked at a coroner's office for a while, and once we had a guy who we thought had died from an OD on meth. Well, we started the autopsy and I went to cut his lungs out and blueberry muffin mix started coming out of them. I stuck my finger in his mouth and it was full of blueberry muffin mix. And it was in throat. Turns out he got just high enough to pass out while eating the muffin mix and he ended up choking to death. I am a pre-med student, and one time while shadowing a forensic pathologist, 3 days before Christmas, he was doing an autopsy on an automobile versus pedestrian accident. The man's face was completely smashed in. When they take samples of the brain, they cut the skin, pull it over the face, and then cut off the top of the skull. When they did that, the skull was basically shattered and bone fragments pulled back with the skin, and when they cut off the skull cap, the brain was obviously damaged and the eyeballs had been pushed back, fallen through the orbits and into the cranial cavity. The guy also had $10,000 in cash in his jean pockets. According to police, he had a record involving drugs, so the theory was either a drug deal gone bad or he stumbled into the road while under the influence. I used to assist with wildlife necropsies for the state Fanwood department. Two come to mind. Someone shot an otherwise healthy looking deer and brought it in because they found something weird when they cut it open to gut it. Sure enough, there was a cantaloupe-sized sphere of tissue in its belly. It had thick, very smooth, slightly rubbery walls. The vet was pretty sure it was an abscess, but said it was the largest walled-off one she'd ever seen hole like this. Cut it open and, sure enough, the walls were about a 1/4 inch thick, and then it was just all pus. A meat cantaloupe filled with pudding thick pus. Also, we got a dead bat in. A little brown bat. They're tiny, and inside it was a dead, also fully formed bat fetus. Near term but without fur. It was almost a third of the size of the mom. Super cool. Edit. I found a picture of the pus cantaloupe. Enter at your own risk, NSFL. I don't consent for this material to be shared outside of Reddit without my permission. For example, on other clickbait websites, list aggregators, YouTube. Not an autopsy doctor, but did take anatomy and physiology II with lab in college. The lab was working on cadavers being prosecuted by more advanced students. A prosection is the dissection of a cadaver, human or animal, or part of a cadaver by an experienced anatomist in order to demonstrate for students anatomic structure. Anyway, one of the cadavers, we had a male and a female for obvious reasons, was a big ol' linebacker looking dude. Like, an older bodybuilder type. His age at time of death was late 50s. His heart has been removed by the anatomist, and we were examining it because it was very enlarged and contributed to his death. We all had to hold it in our hands to feel the heft, like size and weight, and compare it to the heft of the female's heart, which was normal sized, about like a large apple. The male's heart, for comparison, was the size of a small cantaloupe. I went first, for whatever reason, and the instructor lifted the enlarged heart out of its preservative bath and placed it in my hands. I damn near dropped the thing when it shocked me with what felt like a jolt of electricity. I, understandably, I think, made a startled noise, and the instructor took the heart back before I could juggle it onto the floor. "Oh," she said, "I forgot to warn you. Look out for the pacemaker. Apparently when someone has a pacemaker there's a battery too, and they don't bother taking it out off. They just snip the leads and leave it there. So if you touch both bare leads you get a mild shock, even through your exam gloves." That was a mildly disturbing experience. During my internship rotation a couple of years back, a 40-year-old guy came in because he suddenly collapsed while drinking with friends. He came in unresponsive, mouth bleeding, and not breathing, so we had to intubate him. For some reason, the endotracheal tube, the stiff tube placed inside the trachea to help the patient breathe, won't go in, but we managed to suction copious amounts of blood clots. After CPR, still with unsuccessful intubation, so we had to bag him with a face mask. The patient was declared dead and diagnosed with a ruptured abdominal aortic aneurysm. During the autopsy, they found out that the guy was apparently shot by a gun from the top of the head. The entry wound was obscured by his hair and was barely bleeding at all. and the bullet somehow went through the back of the guy's throat and made a hole behind the base of the tongue, which the endotracheal tube kept slipping into. My grandmother had a massive stroke in her 30s that paralyzed her entire left side, and died in her 60s from a heart attack. But while doing the autopsy they found out she had bad lung cancer, but she never had any pain from it because it was in her left lung. She was a very heavy smoker, so it made sense. It's just crazy that she had lung cancer and never knew. Medical examiner here. This probably isn't a big wow revelation, but it certainly made an impact on me. Very early in my career, I did an exam on another doctor who worked at the hospital where I trained. I didn't know this gentleman personally but was acquainted with him by reputation. He was a very happy-go-lucky sort, much loved by everyone in his department. He died unexpectedly at a young age of what turned out to be a drug overdose on pharmaceuticals he had been diverting from the hospital. I don't think anybody saw that coming, myself included. It was a lesson to me that anybody can fall victim to addiction, and that it's hard to know what anybody's private struggles are. I'm a former police officer and attended several autopsies to record info for investigation files. One guy had been shot and killed, so the cause of death was pretty plain. But the pathologists doing the autopsy found a tumor the size of a walnut on his brainstem. He said the guy would have been dead in a few months even if he hadn't been shot. Another guy was dead due to a steak knife being stabbed through his heart by his wife. She claimed she grabbed the knife because she was scared he was going to kill her, and when he lunged at her the knife just went in. But when the doctor pointed out a half dozen or so marks that looked like freckles around the wound, he swabbed to develop a solution that clearly showed they were tiny little poke marks. I was able then to get her to confess that he was goading her. Go ahead, do it, until she hauled off and kebabbed him. It's not always like TV shows where the autopsy is the aha moment that solves a case, but sometimes it really is. Late to the thread, so this will probably get buried. Disclaimer, I am a doctor, but not an autopsy doctor, and had never really considered pathology as a specialty when I was in medical school. This event happened in anatomy lab when I was in medical school. In the preclinical years of medical school, most medical schools have students enroll in anatomy lab where we dissect cadavers as part of the course. One of the anatomy labs had a cadaver who had passed away from complications from kidney failure, according to the identification tab. While that anatomy team was dissecting some of the leg and buttock muscles, they found a bullet in the gluteus medius. No idea how it got there and totally unrelated to the cause of death. I like to imagine the guy signing paperwork to donate his body to science, thinking that the med students dissecting his butt would get a funny surprise. I'm a med student, not a pathologist or coroner, but in anatomy lab the tank next to me had a donor with an inflatable D pump inside his scrotum and shaft. It was completely self-contained. Fluid in the container in the scrotum could be pumped into the shaft tube, creating an erection. Then the fluid would just be released back into the pump and the boner would go away. Pretty wild.